Well, our members, who are healthcare leaders across the whole system, tell us that they have never worried about a strike as much as they're worried about this one. They think that the impact could be really, really significant. And that's, as you say, because it is happening. The strike itself, 96 hours, it's longer than they've experienced, and it is attached to the Easter weekend, and then, of course, the weekend after that, meaning that they're very much expecting to see this disruption happening over 10, 11 days. And it's at a time when quite a lot of doctors will be on holiday and not necessarily able to provide that cover, that lots of the consultants who provided cover last time will be having time off in lieu. And it is a really concerning time because it's not quite clear how to manage that level of capacity loss over such a long period of time. That's why healthcare leaders are working so hard around the clock to think of mitigations, to make sure there are going to be enough capacity, and to absolutely prioritise the most urgent care and patient safety.
Well, yes, and I want to ask you a little bit about those mitigations. But first, to what extent do you think that patient safety could be compromised?
We hear from our members that they are concerned. Obviously, they'll do absolutely everything that they can to manage patient safety, but the real concern is that it might not be enough due to the capacity challenges that this strike is going to cause. So they have told us that they are genuinely very concerned about patient safety during those strikes, and that's on the minds of every single healthcare leader across the country right now.
So what about that mitigation? How hard has it been to get locums in, to get other doctors in to cover these shifts?
Well, of course, everybody's doing what they can. There's consultants, there's specialists, doctors, there's pharmacists, there's consultant nurses. There are all sorts of people within the healthcare structure that can help to provide a certain level of support. But don't forget, of course, that they have their own jobs, and that all needs to be balanced out. So really a big part of those mitigations has unfortunately had to be the postponing of elective surgery and the postponing of appointments, which nobody wants. Of course we don't. We're trying so hard to get down those waiting lists. But at the end of the day, what needs to be prioritised is urgent and emergency care. And that's why lots of people will disappointingly be hearing that their appointments have had to be postponed. And obviously that is a huge challenge, to even the admin challenge to postpone those and then rebook them is huge. So everybody's working as hard as they can to reduce the risk and to reduce the impact on patients. But I don't think that we can fool ourselves. There will be an impact on a lot of people here.
And the two sides in this dispute, the government and the BMA, seem as far apart as ever. The BMA, the Doctors' Union, are talking about a 35% pay rise. You'll know a little bit about hospitals' budgets. How realistic do you think that is?
Well, it's not for me to say, but at the end of the day, it does seem that what the junior doctors are asking for and what the government is talking about continue to be so far apart that those discussions do not seem to have reached a really meaningful place. And that is what healthcare leaders need. They need the government and the representatives of junior doctors to sit down and have a genuine conversation that can work towards a resolution. And they need that to happen urgently, because this level of disruption is incredibly concerning for everyone in the country.
Well, yes, and there's been pretty angry exchanges between the two sides in recent days and weeks. How disappointing is that for you, given what you've said is at stake?
It's very frustrating that they're taking so long to come to a solution here. It's not safe, and it's not in anybody's best interest to have an ongoing stalemate in an issue that is as important as this. This is affecting everybody who accesses healthcare around the country, not to mention, of course, that many NHS staff themselves need to access healthcare, and their families and friends do. So this is affecting everyone. It's extremely concerning. Clearly a solution is needed. Nobody who takes industrial action does so lightly. There are genuine issues here. They do need to be resolved, and we ask both sides to sit down and have conversations that are going to achieve that resolution.